Hello, good morning. Welcome, everybody. Thank you so much for joining the Vitalyst Health Foundation Systems Change Workshop. We will get started in just a few as we welcome folks from the waiting room. Thanks for joining us. As we're welcoming new folks from the waiting room, feel free to introduce yourself to the in the chat room, your name, your organization, where you're zooming in from if you'd like. All right. It looks like we have a steady pace from the waiting room, and we have a lot to cover in an hour, so we'll go ahead and get started. Thank you all so much for joining us. My name is David Martinez. I direct the Capacity Building and Grants Program and Civic Health Portfolios at Vitalyst Health Foundation. I'm joined by my colleagues Erica Foster, Michelle Goodthunder, and Sergio Paris. That will be helping answer any questions that might come up during the session. And then at the end of the presentation, we can have an open Q&A session as well. But this is a new information session that we are hosting as we have opened our Vitalyst Health Foundation grants cycles for our new fiscal year, which began July 1. This is a unique information session in that it is the simply covering the criteria of systems change. So the Vitalyst Health Foundation Systems Change Grant Program have criteria that it must be in collaboration to improve a health outcome with the systems change lens and a budget that is consistent with the proposed scope of work. More often than not, the misalignment that we have seen from applicants or prospective partners has been the systems change criteria. We understand it can be a bit difficult to understand and to see, especially as you'll learn the more implicit conditions of systems change. So we wanted to begin this webinar series and complement existing work that Vitalyst has done to build understanding about systems change. So here are some of those ways that we have built understanding of systems change. One is to draft what we call a Spark report, or that is essentially a white paper that is available at vitalysthealth.org, where you can read much more in depth about how we frame systems change. We also, especially in collaboration with Sergio, who directs our strategic communications, have showcased more of our systems change grant partners in our Spark podcast. There you'll see the awesome Jacqueline Peterson, who leads Feeding Matters and that collaborative effort tackling pediatric feeding disorders. And all of this thought partnership has been with FSG, which is a national consulting group, and systems change experts. For folks that attended last year's or 2 years ago, AZ Impact for Goods conference, we hosted their national president, John Harper, recorded the webinar with him, and that's all posted on our website and social media channels as well. So we want to do a better job with helping folks better understand what we mean by systems change. So with that, let's get started. We're going to start before we take a deeper dive into framing systems change is just first of all starting with what is a system. So here you'll see this definition from a framework for evaluating system change initiatives that frames systems change as a set of interconnected, interdependent, and interacting parts that form a complex unified whole. So more simply, a system that is a set of parts working together to form a more complex whole. There are a variety type of systems that exist in our world. We might think of like the solar system as a type of system. But even if you're bringing it back down, I like to think of like a simple thing like a bicycle as a system in and of itself. Of course, as we think about the bicycle, there are different components. You got the pedals, you got the chain, the handlebars, the seats, the tires. Those are all working together to form a unified complex whole, as is noted. And those parts all have to work together. So there are a variety of different systems that exist. As we begin to frame what we mean as a system that would impact the ability for an Arizonan to live a healthy life, those systems often involved more institutional efforts. Government often is a system, and oftentimes the barrier that is keeping that system in place that is inhibiting a person's ability to live healthy. There are certain characteristics of a system that you'll see here. As I mentioned, a system is very complex, but is a unified whole whose goals and results emerge from its interaction of the different components. So these could be different things like people, organizations, ideas, resources, policies, etc. A really complex and challenging thing about a system is that it's often not linear. It is more of like a bowl of spaghetti. And often people that work in systems have counterintuitive behavior because that work is not linear and can be really complicated. We, as part of our grant partner learning sessions, often do this activity where all of our partners scatter around the room and are tossed a ball of yarn. And as folks pull that yarn, there's different tension points that exist within that system that we have formed in that activity. And that's because it showcases just how nonlinear the efforts is and how there is often this tug and pull that exists within systems. System work is hard work. It takes a lot of people, it takes a village, it takes the time, it takes a lot of resource. And we know that change often happens within systems change efforts. Systems are dynamic, they're constantly evolving. Even if you're thinking about, our solar system, the Milky Way, right now we're kind of on the third rock from the sun, spinning ourselves around the moon, around a sun within a larger galaxy, which is made up of even more galaxies as you begin to go. It's constantly evolving, constantly changing and moving. Oftentimes with systems, there is decentralized controls as well, which makes it really difficult to really tackle system change because there are so many different levers to pull and the decentralization concept. But what's really fascinating is that because this work is non-linear and constantly evolving, there are both movements happening bottom up, but top down as well. Here is a visual of a system just to put things into perspective. As folks begin to think about systems approaches, systems thinking, and eventually systems change efforts, it's always good to start with sort of mapping out the system and just seeing how complex it can be. Um, as you begin to develop these systems maps, you center the individual or the community that you are trying to work with to improve their condition. So, in the example in the case study that we are reviewing today, in the next few slides, I'm going to focus on the early childhood system. So, there in the middle of this very complex map, you see child 0 to 8. Those are the people or the population that we're trying to improve the system for. And then in this, you see different quadrants. So the top quadrant, you see partners that are working in care and education. Then if you go clockwise, you see health partners, social services, other influencers, and then parents, family, and community wrapping up on the left-hand side. You also see different colors that frame what exactly subsector or sector those partners might find themselves in as well. So you'll see in kind of that green color practitioners, orange are settings, blue are support role and organizations, and the red color is the policy, funding, or governance players in those spaces. So for instance, if you look at in the upper care and education quadrant, there is green squares that represent different practitioners that engage with children 0 to 8, like school administrators or child care teachers or early intervention specialists. If you go over to the health space, there are orange boxes around settings that engage children 0 to 8, like hospitals, clinics, medical homes. Continue around the blue boxes, you see those support role in organizations that engage children 0 to 8 as well, including mission-related nonprofits, home visiting and parent education providers, faith-based institutions, and then finally, red boxes are those policy funding and governance folks um, like parks and recreation departments or school districts or family nutrition supports like WIC and SNAP, which are nutrition assistance programs. You'll also see there's concentric circles that represent the levels of proximity to the children's lived experience, again, focusing on child 0 to 8. So that close circle are those folks that are closest to children 0 to 8. Obviously, parents or caretakers, childcare teachers, medical providers, social workers. And then as you get out to that next concentric circle, you're still close to the child, but a little bit further out. You might have other allied health professionals, other family neighbors, other cultural institutions or elementary schools. So it begins to get a little bit further out from the child. And then finally, that third concentric circle, still connected and engaged and have influence and impact the child, but a little bit further out from proximity for their lived experience. So very complex. It can get really overwhelming really quickly, but it's important to see the overall system before you dive deeper into kind of what might exist as a barrier to those systems, which is where we start getting into the systems change. As you're working in a system and working, especially in our case, to improve health, you might see that there is a condition that is holding the problem in place that needs to be changed in order for us to impact health and hopefully have a positive health outcome from that. That's beginning to move from a systems thinking approach to a systems change approach. Um, the systems change ability really is your effort to influence what that root cause of the problem is. So this is where we often say too, especially in the public health space, we take an upstream intervention rather than a downstream intervention. Downstream interventions being a bit more programmatic or direct service approaches to improving health, which are still good, still needed, but what we are supporting through our grants program at Vitalyst are those upstream interventions that are tackling the root causes of the problem and our greatest health disparities here in Arizona. That change often happens through some sort of policy, systems, or environmental change. That is why we support systems change through our grant programming. Very simply, systems change involves influencing how the parts of a system interact that ultimately alter the system's outcomes. At Vitalyst Health Foundation, as many of you know, we are working to improve health, but we see health as more than just health care. We look at the broader social determinants or social indicators of health. We refer them to as the elements of a healthy community, affectionately called the will, as you see here. So this system change approach can be applied to really every element of a healthy community. As you're beginning to explore alignment with Vitalyst and our grant opportunities, this is a great question to clarify mission alignment. So if you are working in an area seen in one of these spokes of the wheel with a systems change lens, then you begin to find alignment with our grant programming. If you don't see your specific area or effort or subsector reflected in a specific element, it likely is integrated within that specific spoke. And if you visit vitalysthealth.org, we have a drop-down link where you can take a deeper dive and look at the specific efforts, strategies, actions, health outcomes within each of these spokes of the wheel. As we frame system change efforts and hopefully build understanding, we use this inverted pyramid visual that frames the different conditions of systems change. This taken from the Waters of Systems Change, as noted there, a visual that we have really embraced here at Vitalyst that helps begin to frame different conditions of systems change. in total, the most transformative kind of systems change is when you meet all six of these conditions, and then hopefully the system itself, as an overall system, has been changed. However, know that that often takes several decades, several partners, several resources, a lot. And it is not our expectation that with any one of our systems change grant types, that you have to tackle all six. Usually, our systems change grant partners are tackling one or two of the conditions. But your overall systems effort might have efforts over time of each of these six conditions. So you see here on the top tier the structural change conditions of policy, practices, and resource flows. These are the most explicit conditions of system change and often the easiest to frame as system change because they are a bit more tangible. When you are advocating for a policy, you actually see the legislation, like support House Bill 1 or whatever it is. Even as you move over to practices and resource flows, those are also a bit more tangible, like different practice or regulatory changes that might need to happen, say, at a city department or within a healthcare institution. Resource flows is another big one. We see this a lot with our state Medicaid system access, where systems change partners might want to change that system or that resource flow condition is through like access reimbursement. So then those resources begin to flow. Then as you get to the middle tier here of relationships and connections and power dynamics, these are a little bit more difficult to see, but might still be an effort that we can support. This is where, as you are exploring the systems change grant process and the application, if your effort is framed around one of these more implicit conditions, it really is important for you to see the effort as systems change and frame it as systems change to make your proposal as strong as possible. And then finally, on the very bottom, the condition of mental models. This is the most transformative change. This is where you change hearts and minds. It's very hard to see that though. But a perfect example I have of this is a very large systems change that was shepherded by Mothers Against Drunk Driving, or MAD. Many people are familiar with it, right? So they, over several decades ago, saw this problem with their children and family members dying in car accidents from drunk driving. So they embarked on this long-term systems change that did involve all of these conditions, especially right policy and practice change that especially through law enforcement. But then overall, they wanted to change hearts and minds about a person's ability or a person getting behind the wheel after having some alcoholic beverages and really changing hearts and minds about that concept. A pretty successful, but still a lot of work to be done, obviously, on that front. So to take a deeper dive into each of these, and so you can really begin to hone in on, okay, exactly do you mean when you say the condition of policy or practice or resource flows, relationships and connections, power dynamics, and mental models? So here again, you'll see the categories of structural, relational, and transformative change going again from the easiest to see, the most explicit, to the more difficult to see, implicit at the bottom, policies to mental models. And then you see a better descriptor of within each of those conditions. So for policies, again, these are government rules, regulations, and priorities that guide its and others' actions. These are laws. So when you're looking at changing the condition of a policy, that would be like advocating for specific legislation, whether it be federal, state, or local. And then you'll see the different descriptors as well for practices. These are more organizational or institutional, oftentimes regulatory in nature, that aren't always involving policy or legislation, but are impacted for sure. I touch a little bit about the example with resource flows as well. It just doesn't have to be a monetary resource. You can look at people, knowledge, and information and how that is shared as well. A perfect example of this that we see in the health space are health information exchanges, right? That's information that a system it can incorporate to improve a person's ability to get services and the healthcare they need. We also see this with the referral systems that exist within social service providers that are that access is really trying to bolster as well, so folks can easily access the services they need. Relationships and connections is another important condition as well, because as you saw with that systems map, there are so many different players within the systems. This one is really hard often for folks to define because they connect it with kind of the relationships and connections that exist as part of a collaborative that is formed to trying to tackle a systems change efforts. So if your work is more so around building up those relationships and connections of a collaboration to eventually tackle systems change, that would be much more aligned with our technical assistance grant and supporting collaborative capacity building. Power dynamics is another important condition within systems change because that barrier that is keeping that system in place is often a dynamic that is controlled by a particular person or entity or agency. And that's who you're trying to impact and influence so that the system is then changed. And then finally, as I mentioned, the mental model, really changing the hearts and minds and these deeply held beliefs and assumptions that are influencing actions. So to go back to our case study around early childhood, we are looking at this specific challenge and are going to go condition by condition at a very quick pace. But you can certainly return to this recording and we'll share out the materials as well so you can look at the particular aspects of diagnosing structural conditions. So this is an activity that you can walk through with your collaborative to think through, okay, what is the problem, the challenge we're trying to address, and diagnosing within each of the condition to then determine we want to prioritize focusing on this particular condition. So I'll go through each of these conditions over the next few slides. So we're going to start with the challenge. You'll see that in the gray box there. Arizona's pre-kindergarten kids or pre-K kids, especially in rural and tribal communities, are not kindergarten ready. That is the case study that we're tackling today. Your issue, of course, can be a lot of different challenges that are that you want to focus on to improve health. But this is the case study that we're using today. Arizona's pre-K kids, especially in rural and tribal communities, aren't kindergarten ready. So if you look at the condition of policy, this is the structural condition that exists currently that is making that the challenge. So pre-K kids, including those with developmental delays, don't have access to early intervention programs and services. So that's the problem, right? We're not talking about solutions yet, but that is the problem that is making that challenge even more pressing. Moving over to practices, some Arizona pre-K kids don't have access to programs using evidence-based practices. So this might be in a child care facility or pre-K, Head Start, those kinds of things. That's the problem that is preventing more Arizona kids from being kindergarten ready. And then on resource flows, the problem is that preschools, home visitation programs, and other early learning initiatives are underfunded. Again, the resource flow challenge with that. That problem is that underfunded problem is making it so that Arizona pre-K kids are not kindergarten ready. So now that we looked at the problem reflected in each of the conditions, we can now look at the different strategies that would change that condition and ensure that we reach our goal or the ambition that Arizona kids begin elementary kindergarten ready. So connected with the policy, this was actually real life legislation. The effort would be to pass House Bill 2137 that enhances Arizona's early intervention programs and services for infants and toddlers with developmental delays. So again, going back really quickly, the problem was that kids didn't have access to these programs and services. So the solution, the strategy was to pass a bill, a policy that would enhance that programming. Similarly, for the practice change, this is the solution or a strategy that would help us reach our goal that Arizona kids begin elementary kindergarten ready. So again, the problem in this case was the programs weren't using evidence-based practices. This solution is working with those to implement research demonstrating effectiveness or demonstrating effectiveness in promoting early childhood development. So ensuring that those institutions, those organizations had those practices in place. And then finally, the solution for the resource flow problem, again, going back that these programs were underfunded, this would be the strategy is to advocate for funding for access to early childhood education. So again, we present the problem and some solutions for each of these conditions. So this is an activity that you can walk through with your collaborative associated with your challenge you're trying to tackle, the goal, the ambition that you want, and then look at each of the conditions to begin to think through different interventions and solutions that your collaborative can embrace. As we move to this middle tier of the inverted pyramid here, the different conditions, again, we're going to start with the challenge of Arizona's pre-K kids aren't kindergarten ready. And in particular, for relationships, early childhood programs do not have a trained, well-compensated workforce to improve the quality of care. So those are the relationships that are needed in order for pre-K kids to be kindergarten ready. And then on the power dynamic side, this is really about those, again, closest to the children. The families aren't connected with necessary resources, and the local communities don't play a key role in deciding how to best utilize funds based on their specific needs. That's a problem that is keeping pre-K kids in Arizona not kindergarten ready. So now that we've identified those problems within the conditions of systems change, we could think through different strategies or solutions to reach our ambition. So again, in the relationships, this would be advocating for investments in early childhood workforce, because again, if you go back to the problem, there is not a trained, well-compensated workforce to improve the quality of care. So that would be a strategy within the relationship condition. For the paradigmatic solution, these strategies would be to provide family support services and programs that strengthen parenting skills and promote healthy family dynamics, and then also have a community-driven approach. So you'll see this effort, the intervention or solution to change this condition of power dynamics influences the kid's ability to be kindergarten ready. And then finally, the problem that exists within the mental model condition that is prohibiting pre-K kids from being kindergarten ready is that these pre-K kids and their families feel unsupported during this critical early childhood development window. Not enough Arizonans know the importance of early childhood in local communities, and Arizona really doesn't prioritize or invest enough in early childhood programs. These are all mental model shifts that need to happen in order for us to address that challenge. So what do we do about it? The solution, the strategies include, building up this collaborative with business, education, community leaders that emphasize the importance of early childhood in local communities, and then raise awareness. In this mental model effort, you might see a lot of this kind of marketing campaign awareness opportunities to build up knowledge and awareness of the issue in the first place so that it can be tackled collaboratively. So again, the problem there noted, and then the different solutions for that mental model shift. So that reviewed the inverted pyramid, and the different conditions of systems change. Again, you don't have to tackle all 6 of them, certainly with the support provided through the Vitalyst System Change grants, but you can begin to think through with your collaborative, okay, what are those conditions that we want to focus on as part of our grant effort? As I mentioned, systems change work is a bit more upstream as opposed to downstream interventions, which are more programmatic or direct service. And in here, this slide, we begin to frame it, especially to show that difference. So systems change efforts take a village. It's hard work, and that's why both our grant program has a grant criteria of a collaboration that is needed. but also because systems change work takes a collaborative, unified effort and really bold goals and strategies so that the efforts can be advanced. The systems change efforts often tackle the root cause of problems, not just symptoms. So a perfect example that I use of this, because my colleague Sergey and I used to work in food banking, is the tackling the concept of food insecurity or hunger in Arizona to tackle the root causes of problems is an upstream intervention. The downstream intervention would be like accessing a food bank. That food bank work is very important. People are going hungry and needing food boxes, emergency food boxes today. But what the upstream intervention, the root cause is like, why are people having to go to the food bank in the first place? And asking yourself that question helps tackle the root causes and gets you up to the systems change level rather than a symptom approach. System change work should include those closest to the problem and have them be closest to the solution. That's a key component of our collaborative criteria and how we hold an equity lens in our grants program as well. So as you're thinking about systems change approaches and pulling together your collaborative, that is a really important aspect for our grants program, but in any systems change effort as well. As you saw in the systems map of child 0 to 8, the child 0 to 8 is in the middle, and those closest to that population should be engaged as part of your systems approach as well. That work also, because it's in collaboration, should have a strong sense of shared leadership with that community engagement and really the community and those, again, with that lived experience driving the solutions for the work. And as I mentioned, system change work is not linear. It's like a bowl of spaghetti. Change happens within systems change efforts, and it's incumbent upon the collaborative to continuously improve and learn as you embark on systems change efforts because it is ever changing and it can impact in a lot of ways what your approach is. So, for instance, something that we're seeing right now is efforts that are trying to change the condition of resource flows around Medicaid reimbursement here in Arizona are not completely paused, but more so on the back burner because the state is working and partners are working to implement HR1 and a lot of the new Medicaid requirements and the cuts that have come down from the federal government. So because of that federal policy, that changed the condition on the ground to that would make it a bit more difficult to advance the resource flow change needed as part of that effort. This might also be seen with a change of the legislature or the governor's seat or any other decision maker, especially if you're working around policy or practice change. And then on the opposite side, these are more programmatic efforts. So system change efforts do not include, again, only addressing the symptoms of the social challenges. Think through the food bank example I gave, tackling food insecurity. Some of this could be like subsidizing healthcare costs and, again, distributing food boxes. System change effort does not include delivering programs through a single organization. So that's a clear example of misaligned efforts as systems change, especially for if that entity is not engaging with or coordinating with others that are really influential in changing that system. This is a really big aspect when we're thinking about as you're thinking about building the collaborative is ensuring that the right partners and have the right roles within that collaborative. Because if you're trying to say improve the educational system or some aspect of education and you're not involving, say, the teachers union or the school administrators or a parent and family organization, you're probably not taking a systemic approach. And then also, system change efforts don't include only pursuing outputs and small baby step progress. So this is another perfect example of offering programs, say, that distribute food boxes. A system change approach wouldn't be like the amount of food boxes distributed. It would be about tackling the root cause of food insecurity and addressing that food system in the first place. So we're going to do a pop quiz here now. to get some interaction with this and help you think through what is a systems change or a more programmatic change. I'm going to turn to my colleague Erica, who I believe formed the Zoom pop quizzes. So you should see that pop up on your Zoom screen now. So the question is, for each of these examples, is it a systems change or a program change? So for the first one, you have a coalition that's collaborating to design and execute an awareness campaign to destigmatize the best feeding parents may provide to their babies based on their needs. So is that a systems change or a program change? Take a minute to cast your vote for that one. Similarly, the second example there that should still be on your window is a school partners with a local dentist to provide free or low-cost dental or oral health. Is that a systems change or a program change? Please continue to cast your votes. And then the third example, prenatal service providers implement a one-stop shop referral system to better coordinate services and supports for pregnant mothers. Is that a systems change or a program change? So take a moment to pick either system change or program change for all three examples. We'll keep this open for just a minute longer as folks are casting their votes. Is it a system change or a program change? All right, seems the votes has kind of slowed down. So Erica, if you want to end the poll, and then we can hopefully see the answers from there. We could share the results. So in the first example, you have a coalition that's collaborating to design and execute an awareness campaign to destigmatize the best feeding parents may provide to their babies based on their needs. We had 83% votes for systems change, and those 10 folks would be correct. When we're reviewing kind of alignment with system change, we look at a few buzzwords as I've been reviewing through this slide deck. So the first one that should pop out with you is a coalition collaborating, right? We say system change is hard work. It takes a village. It takes a coalition of partners collaborating together. So that should be your first sign that it is indeed a systems change. Another word that might pop out at you is awareness campaign. One of the conditions of systems change is that mental model condition, changing hearts and minds. Again, that would be aligned with that condition. So those are ways that we help us better define if it is a systems change approach or not. In this case, number one is systems change. Number two, we had 75% say this effort is program change, where a school partners with a local dentist to provide free or low-cost dental oral health. That is correct. This number two is program change. First of all, you have a school, one individual school. That is opposite of a collaborative effort, right? And then the service being provided is dental or oral health services. So again, very important work, but more downstream intervention rather than the upstream intervention for systems change. So number two is a program change. Congrats. Now, last but not least, this one's always tough. This one is a split vote too, but majority of the folks voted that prenatal service providers implement a one-stop shop referral system to better coordinate services and supports for pregnant mothers. A majority voted that this was indeed systems change. And in many instances, this is referred to as systems change. I will say there's a huge asterisk to this because in many cases, this coordination of care may not exist. The system may not exist, especially in rural tribal communities. So a referral system may be seen as a more systemic change. If this is an effort that you're considering for a Vitalyst System Change grant, just note that more often than not, actually, our reviewers have seen this as a more programmatic change, especially if it is in a well-serviced area and if the effort is simply to coordinate amongst services and not really look at a more systemic approach and ask yourself, why is that a problem in the first place? So that one's challenging, but depending on where you're at, can be seen as a systems change. So we'll go ahead and stop sharing this. Oops. And then continue on. So just going forward, a couple of pitfalls that we see from our community partners, and I'll just put all of these up, is as I mentioned, there are 6 conditions of system change as we frame it. You don't have to tackle all of them as you consider applying for the Vitalyst System Change Grant. In fact, it is we look at, okay, what impact can our grant have in your effort to advance systems change on a specific or one or two conditions. So you might overall have a campaign to tackle all 6 conditions, but with Vitalyst grant funding, what specific condition are you tackling? So you don't need to do it all. Um, as I mentioned, there's downstream interventions and upstream interventions to work. The downstream interventions are more programmatic or direct service. We do not demonize that work because it's important work that needs to be done. At Vitalyst, however, we just want the effort to be to also include an upstream or top row intervention, or not top row, just upstream intervention to tackle through systems change. That top row are those policy, practice, and resource flows, often that people don't want to engage in and say, no, I don't want to engage. That's not an approach to take. So we don't demonize either the top row or programmatic work. As I mentioned too, systems change is nonlinear. Change happens within system change efforts, and your collaboration needs to be willing to pivot as needed to address any of the changes that happen with the nonlinear aspects of systems change work. And then, as I mentioned, systems change work takes a village. We have a specific criteria around collaborations. As you're continuing your systems change efforts, you always need to continuously look through who is at your table. First of all, to ensure that, again, those closest to the problem are closest to the solution. You're engaging those community members with lived experiences. But as we just discussed, it's linear work. So the change might happen within your system change efforts. And the people you need as part of your coalition might change as well. So for instance, we have a Republican-controlled legislature right now. So you might want to engage Republican or conservative partners that can help influence those Republican legislators. But after the November election, if the Democrats take control of the legislature, you might need more Democratic or progressive-oriented partners to help influence the decision makers as well. So you always need to look at who is at your table. So just to kind of take a step back and reflect a little bit again, here are 3 ways that you can begin to think through how you're framing your work as systems change, or if it is indeed a systems change approach. You start with your goal, right? We have this ambition to change this system because we are seeing the problem that exists overall, the challenge, but then going through each of the conditions and thinking through what are the problems that exist within each of those conditions, right? Like we did with the case study around being pre-K ready. And then as you're thinking through those problems, then begin to explore the strategies, the specific interventions or solutions that are helping you address that particular problem that will help you achieve your overall ambition and your goals. So here's a very simple worksheet that you can complete with your collaborative to really think through the different conditions and what elements exist that are reinforcing that current condition. You know, the barrier that is being kept into place and hindering your progress, and then jot it down quickly within that box. And again, you can reflect on each of those conditions or one or two that you're specifically focusing on. And then in the next column, begin to think through, okay, now that we know what barriers are in place and reinforcing the current condition, what are ways, what are strategies that can help advance our system change efforts, and who should be involved? Again, the right partner in the right role with the right responsibilities. So just an easy worksheet to help you facilitate and think through this system change alignment with your partners. So just finally, to wrap it up before we open it up for some questions, as you may have them, really think through, okay, what is going on in the system that we're seeking to shift? As we begin to have discovery consultation calls for Vitalyst grant opportunities, we always start with, okay, what is the system that you're hoping to work in? And then you think through, okay, what are those systemic conditions that are holding the problem in place? And that's what we ultimately want to tackle with our systems change grant opportunities. Uh, Stepping back also and looking at the systems map begins to show who is connected in the system and then who are those partners and relationships that will be helpful to influence the systems change that you're hoping to make. That systems mapping approach is a really important thing to start with, and especially to think through who should be in your collaborative. And then finally, really thinking through who those collaborative partners are and working through building up the infrastructure, the trust, the different roles and responsibilities needed for you all to achieve your shared vision for systems change. So just a few final reflections as you're embarking on your system change efforts and continuing to hold a systems thinking lens in this work. These resources are posted on the vitalysthealth.org website. You'll see different articles and again, our Spark report videos that we have posted. We have been partnering with FSG, which has additional resources as well. So I'll pause here just if folks want to capture these QR codes. But again, we'll share these materials out so you can look further into these as you would like. We are providing this overview of the systems change criteria because our three-tier grants program at Vitalyst is meant to support collaboratives that are building their capacity, planning, and implementing systems change. So the technical assistance grant, the Spark grant, and the systems change grants are our three-tier grants program. In total, it's a 5-year grant potential of $230,000. Again, supporting collaboratives working towards systems change. It just depends on where your collaborative is at in their journey towards systems change in order to determine which grant you might be best suited for. Uh, at Vitalyst, we have an open door policy. So as you're doing your research and you do see alignment with one of our grant types, you can go to the Partnering with Vitalyst webpage at vitalysthealth.org, complete the discovery intake form that's on that page, which is not the grant application. It's simply an interest form, essentially a letter of interest where you have an opportunity to, at a very high level, provide initial concepts about your system you're hoping to change, what different strategies you're thinking about. And this is the process that we use to facilitate conversations so that once you complete the discovery form, we'll review it. And if it is aligned, you'll be prompted to schedule a time to chat with one of the Vitalyst team members to review your effort, your project, and determine alignment with one of our grant types. And if aligned, get you connected with the process for each of the grant types. That was a very broad, high-level overview of our framing and helping folks better understand systems change. If you do want to learn more about the specific logistical aspects of our grants process, we will be hosting a separate virtual information session on August 11th, tomorrow, that you can register for if you have not yet at vitalysthealth.org, the Partnering with Vitalyst webpage. That material and recording will also be shared and posted on our website as well as we begin to go through our grants cycles. So if you have more specific questions or information desired around the logistical aspects of our grants, please register for that webinar tomorrow and or keep a lookout for that material posted. With that, I'm happy to ask my colleagues, Michelle or Erica, if there were any questions that popped up during the session, or if folks have a question, feel free to use the raise hand function and we could answer them or try to answer them live.
We just had one question in the chat. It says, is it safe to say program change is a step towards systems change, or can they happen independently of each other?
Ooh, this is a good question. And not to put you on the spot, Abby, but Abby has been a great collaborative partner as part of our systems change efforts, especially with our grant partner learning sessions. So I'd be curious to hear your answer to this, but I think um, there are bigger aspects of systems change that can involve programmatic change. However, from my experience reviewing grants at Vitalyst and with our grant review team, the funding that Vitalyst has is geared towards the overall systems change or the condition that you're hoping to change that we reviewed, one or two of the six that we reviewed. So it's the gray area, I guess, as you might see within systems change, especially the more implicit types that might be a bit more programmatic in nature, but important to an overall systems change. An example that comes to mind that I often see that has not been supported singularly for Vitalist grant programs is there might be like a mental model change needed around, say, like mental health services for law enforcement agencies. There is a stigma that exists with law enforcement officers seeking mental health services and what that might mean for their career or, just the perception that they're able to do their job correctly. However, we know that law enforcement officers experience trauma every day and need mental health services. So an effort might be to a programmatic effort might be to implement a mental health training for law enforcement providers. That is a more programmatic aspect that, yes, can lead to that overall systems change, but that is not an effort that would be supported by Vitalyst grant. What we would explore is, okay, is there a practice or a policy that needs to be changed that would incorporate that mental health training or screening so that that those services, that program is available. So you're tackling the practice change or the policy change that is keeping that problem in place. That again can lead to that overall mental model shift. Abby, do you have any other insights into that or reflections?
I thought your answer was great. I'm not sure, besides echoing different points that you made, that I have something new to offer. I guess maybe my lens is that systems change is such a broad space and everything is so interconnected in it that it is sometimes hard to extract like the difference between the programmatic. My encouragement to you all is to recognize the power of these big systemic changes and the big upstream roots of the problem approaches, while also recognizing, to David's point about food banks, that the programs are important. And it's not to say that you shouldn't continue to do that work, but the differentiation here is what is funded versus what is part of the overall system work. So, David, I think your examples were great, and this work is incredibly complicated. But the more you pull yourself upstream and into more of the roots of the problem, the more you can start to see these like bigger levers of change. So nothing super new to add.
Awesome. Thank you, though. Thank you for
Mhm.
that. Paula, how are you, my friend?
Hi, David, and my beloved Vitalist family in TAP-AZ. By the way, for everyone listening, I'm a fiscal sponsor of the organization, and I've listened to this before, and I just wanted to give kudos to the little questionnaire, because I know when I was first going through this, trying to understand that small shift, what's a systems change and what's practice. I thought this was fabulous, by the way. But I do
Mhm.
have a real question, but I just wanted to share that.
Thank
Um,
you.
I'm working on something that's for rural health transformation with a larger collaborative group, and I'm wondering from your experience, when you're dealing with things in rural communities versus systems change, and like say Maricopa, where a lot of the population of Arizona is. A lot of the things is having resources. I would think the mental mindset on some of that and rural things is a campaign to get out to the people to know what types of changes are happening, that they can access stuff. But anything on that that you could comment between rural community systems change and city living city change?
Sure. Yeah, thanks for that question, Paula. I'll try to tackle kind of it in a couple of different ways. One, there definitely is a change of systems approaches I see in rural versus urban settings. Mostly because as the example, the third example, right, there might not be a system in place in rural
Right.
communities. We have a partner that is focused on water rights and tribal sovereignty. The efforts were to kind of build water systems in tribal communities that don't have, say, running water. That was the effort that they had proposed. And that would change a system because they are implementing a water system. It was a bit misaligned with Vitalyst because we, one, don't do capital projects like water infrastructure and whatnot. But what we did engage on is their overall efforts to just boost tribal representation and tribal voice as part of water rights discussions as those policies and practices are being implemented. So it's very nuanced. So I do see a difference, right? And another example, we had a partner down in Santa Cruz County that was really trying to work with their law enforcement around domestic violence cases, and what folks had access to in Santa Cruz County without having to drive up to Tucson or Pima County for those services. And especially because that there's a good amount of distance between Nogales and Tucson. Folks from Nogales might have mixed status families, and there, of course, is an immigration checkpoint along I-19, so that adds barriers. So that whole effort was a bit was seen as a bit more systemic because of the nature of rural life, whereas that might not be the case in Phoenix or Tucson, for instance. You mentioned the Rural Health Transformation Program, and there is certainly a lot of awareness that needs to be raised with this. That is definitely something that we are working on here at Vitalyst. If you are engaged in that effort to secure the federal funds that have gone to the states, I would definitely have you reach out to us to provide as much support as possible, because my colleague Anna Rossetti is working with other partners who are pulling together that application pretty soon here. I'm not quite sure, like you mentioned, kind of raising awareness about all of those things, if that would align with our grant programming, but that's why we have our the discovery intake process. So again, if you are kind of seeing alignment as a system change effort and with one of our grant types, go to vitalysthealth.org, our Partnering with Vitalyst webpage, and complete that discovery intake form, which is how we begin to have a conversation to determine alignment or not.
Thank you.
Mhm.
And I would want to get in contact with Anna. We've been going to the access things. I didn't know Vitalyst had something, and we're planning on submitting something that's similar to other communities but different in healthcare and food and stuff. So I would love to get in touch with that.
Wonderful. Yeah, feel free to send us an email. Any other questions as we get to the top of the hour here? Perfect. As Erica just posted in the Zoom room, please do visit the Partnering with Vitalyst webpage at vitalysthealth.org, where you could take a deeper dive into all of our grant types. And as you see alignment, complete the discovery intake form. We review those opportunities throughout the year, but our Spark grant and our System Change grants are on a specific grant cycle with a deadline in October for both of those. Go to the complete a discovery intake form if you are interested in exploring those. And again, we will host a separate virtual information session on August 11th, tomorrow, to review the specific grant logistics of the systems change grant. So register for that though we will record and post the materials on our website as well. Thank you all so much for joining us, and I hope you have a safe and healthy day. Take care.